Hello, today's topic is about pediatric fractures or fractures in children. Now, this is a common question I get asked in the OP. Will there be a deformity? Now, children's bones are different from our bones in two respects. One, the bone is soft. Two, the bone is growing. For us, the bone is hard and it does not grow. It does not grow in length. Now, for children, the bone growth happens near the ends of the bones, and it is near the ends of the bones where joints are there. For example, the end of this bone is near the wrist joint, the end of this bone is in the wrist joint, the end of this bone is near the elbow joint. So if there is a fracture which affects the growing part of the bone, there is a chance of deformity. Or if there is a fracture near a joint, there is a chance of deformity. Now this requires x-rays and some cases CT scans. Usually in growth plate injuries require surgery. It requires precise correction of the deformity, correction of the fracture and stabilization, because if the growing part of the bone unites incorrectly, it will cause deformity. Now, what about the part of the bone which does not grow? That is the central part. It depends on the age. Slightly older children or heavier children, we prefer fixation so that we can mobilize earlier. But for younger children, in general, we can manage by plaster. It depends on the site of the fracture. For example, the hand versus the thigh bone or the leg bone. The treatment is different. Thank you.